We have, again, iliac crest. This whole region is the iliac crest. PSIS are these bumps right here, a little bit harder to feel than the ASIS. So that's the PSIS. Just medial to that, this is where your sacral base is. Where my sacrum meets the PSIS is the sacroiliac joint. So on your list, you'll see there's like sacral base, PSIS, and then SI joint or sacroiliac joint. They're pretty much like in the same region. As long as you can find that PSIS, posterior superior iliac spine, you should be able to find SI joint and then sacral base, because the sacrum is like a triangle. Is it okay if I palpate the bone you sit on? So when you ask the patient, because this is where UB36 is, so this is where your hamstrings are. So your hamstrings attached to the ischial tuberosity, but when you palpate it, if you're in clinic, it's usually where the gluteal crease is. But if you're palpating it, you're gonna use two hands so that you're not like groping them. You're gonna go like this, and then you just go in and you can go back and forth, and I feel a bone like pushing out at me. That's your ischial tuberosity. That's at the pelvis. These are the glutes. So when you're looking for like gallbladder 30, you need to find like the sacrum, the greater trochanter, and you're trying to divide that line to needle the piriformis. So like that's where this becomes later on more important in clinic. For the final, you could just tell me like these are the glutes, but you do want to palpate if you get ischial tuberosity like this. Lumbar erectors, we haven't done those yet, but those are in the lower back. They extend the spine, so they're just along that UB channel, the spinal erectors. IT band, again, same thing. It's on this pant seam, so that's also prone, because you could palpate it supine or prone. Greater trochanter, again, I can bring the leg in and out and feel that greater trochanter. These are the hamstrings we mentioned. Popliteal fossa is here, so if you wanted to, you could bend the leg. That's the back of the knee. Gastrocs are these muscles here. Medial malleolus, lateral malleolus. You need to know this because if someone were to be needled prone, they could be on a bolster, and you still need to needle and know, okay, this is still the navicular right here, this is the cuboid, because you can needle like liver 3 and then place their foot down because it's not going to affect the needle, so you need to know these prone as well. So calcaneus, navicular from this side, this bump, find the base of the 5th metatarsal for the cuboid, and then the Achilles tendon. So this is also, you're going to be needling here and here later on in the future. So those are the ones that we've done so far. When we do the head and neck, we'll do another video. So we'll just do that for like the lower extremity for now. So you can break up into groups. I'll help you. I'll walk around.